right, I'm going to go over how to use the Algo 5 newborn hearing screen machine. First, you find it. It is stored in the NICU break room. So you go grab it, bring it to the bedside where you're going to be using it. You have to plug it in. So that's the main power cord down here. Plug it into a wall. You'll see the green light means that there is power on. If it's not green, then you just have to flip this switch so that the power is on. Then you're going to go to the front of the machine and you're going to turn on the screen. It is kind of slow. Gotta give it some time to wake up. Always you want to make sure that it's on a baby that is appropriate to be screened. So they have to be term or in the NICU 34 weeks and close to going home. So within days of going home. They can't have any ear or neck or head deformities or known hearing concerns. And then that baby would be appropriate to screen. They can't be receiving any central nervous system stimulants, so no caffeine. And they have to be in a crib, and if they're gonna go home on oxygen, that's acceptable, otherwise no oxygen. Typically wanna do it after a feeding when they're in a calm state, because it's gonna make your hearing screen go a lot easier. Normally I'd wait until the screen is up because then you know your hearing machine is working, but since this is taking forever, I can go ahead and show you. You want to prep your baby's skin. So you need your new prep and some gauze, and you put a little bit of new prep on, and then you just kind of rub it on the area that you're going to be putting your sensors, and then you rub it off. It's just to prep the area. So you're going to do that on the forehead, on the nape of the neck, and then whatever shoulder you want to use. So you have the main screen. I don't know if you can show them the main screen. You can either use keys, or it is a touch screen, so you can hit F1 to screen a baby. This is where you need to know if your baby has ever been screened before. If it's a first time screen, you're gonna just enter their information. If they've been screened before, that is the only time that you would search for the patient. So then you'd be using F3. But we're gonna do this as if it's a baby that's never been done. So you enter their MRN, their last name, first name, their gender, and their date of birth. I did this before, so it's thinking that it's finding the patient. That wouldn't happen when you're entering this on a baby that's never been done. Once you've entered the patient details in that field, you can click F1 or touch the screen that says continue. You have to answer all of these questions. I like to hit set all to no and then just change the few of them if there are any. So like we might have NICU stay 5 days or greater. That might be one that's commonly chosen for us. Low birth weight, examples like that. And then obviously if you don't know, there is the question mark saying like, I don't know. Then you're gonna hit F1 to continue. The only situation where you would be doing ears not simultaneously is if they may be referred on one side. So typically you're always gonna be doing both ears simultaneously rather than sequentially. So then you hit continue. This is where you would check your skin, prep it, and now we'll attach all of our clips to their pieces. And open up your package. I always like to remember red is right. So red goes on the right. Oh, my cords are short. Don't strangle your baby with cords.
So overzealous.
And center their ear in the little cup. Oh, that's not even there. Right. Red is right, people. Red is right.
Right is red.
That's your right side, baby.
Mm-hmm.
Center the ear. Just kind of make sure it's got a pretty good seal. The black goes on the forehead, right smack dab center. It doesn't matter if you clip it up or down, doesn't matter. Go right on that area of skin that you prepped. White goes to the nape of the neck. And then your green goes on the shoulder. One thing I have found in the years of hearing screens that I've done is sometimes when the cords are touching too much, it causes more impedance or impedance. I don't know how to say that word. It causes more impedance. So trying to untangle these and make sure that the cords aren't touching each other is one tip that I've found that helps hearing screens pass a little bit easier. So once you have everything set up and on your baby, you're gonna check your impedance levels. And so obviously with this doll, it's saying that they're too high. You want it to be 12 or less when you're doing a hearing screen. So these wouldn't be flashing red if my numbers were where I wanted them to be. So it's not gonna let me hit start screening, but normally these would be, I don't know if they're green or if they're just not flashing, and then you can hit start screen. So then you start your screening. There's times when you might need to pause it to adjust your sensors. That would be an option down here. So you'd hit pause, you would readjust your sensors to get your impedance levels back down, and then you'd hit resume. Once they are finished, whether they passed or referred, you would just go back to your main screen. So I'm gonna just take you there momentarily so that I can show you how to turn the machine off, because you do have to turn it off. So you do F10 for your main window, and then F10 to exit. And then this is where, like, if you're gonna do another one, you could hibernate. If you're putting it back in the break room, you're gonna do power off and then hit shut down. And that's how you turn the system off. And then you just have to make sure that you document the hearing screen and the results in Epic, and that you tell the families that they passed or didn't pass, and that information. And that is the way you do a hearing screen.